And the second one, maybe a SIBO infection. Could you go into a little bit about how SIBO, what it is and how it is linked to thyroid disorders?
Absolutely. So SIBO is basically small intestinal bacterial overgrowth. Now, most people, listening to this podcast, I'm sure they know about the gut microbiome.
We've hit it hard here. We have hit it hard.
Exactly. And I'm sure. And that is so important to hit it hard because, it basically kind of is one of those gems that we have figured out in the last decade. These trillions of bacteria that lives in our gut. Basically, we have more external DNA in our body than we have our own DNA because of these trillions of bacteria that contributes their DNA towards our health. So what happens is that, because we have trillions of bacteria, some good, some not so good, right? And most of this bacteria lives in either the large intestine or somewhere near that. They are not supposed to be present in the small intestine. So when we see that there is an overgrowth or presence of this kind of bacteria in the small intestine, that's what basically we call as SIBO. Most people know them as bad bacteria or overgrowth of bad bacteria in their gut. Now, what the SIBO causes is multiple problems. The first thing what it leads to is that it actually leads to not able to absorb different vitamins and minerals from our small intestine. And we know the thyroid needs good minerals like iodine, like iron, like magnesium, B vitamins, and all of these absorption is happening in the small intestine. Because of SIBO, they are not able to absorb these nutrients, and that ultimately obviously affects the thyroid. The second thing is that this SIBO also leads to inflammation in the gut. And there is a strong connection between the gut and thyroid. When there is inflammation present in the gut, that leads to ultimate inflammation in the thyroid, and that again triggers Hashimoto's disease.